Hello, welcome to Kitsap Stem Cells and your new journey to health. We are part of the Stem Cell Health Centers here at Kitsap Stem Cells, and this is a quick starting guide for you. There are more detailed seminars available. Stem cells in a nutshell. I'm Dr. Richter, and together with Dr. Malone, we have been serving Kitsap County with stem cell therapy for many years now. Our stem cell products are highly anti-inflammatory. They reduce inflammatory markers such as TNF-alpha by up to 75%, which can be measured in your blood work. They reduce scar tissue. The reason why you're not healing is because you have non-functional scar tissue in your joints or in your organs. And ultimately, that, of course, produces a pain-free new joint and pain-free way of life. And by regenerating your heart and your kidneys and other internal organs, you actually generate longevity. And that's really ultimately what you want. And we are now in the position to say that we will live longer than ever. The first article on the type of stem cells that we are using was published in 1974. People found that there are highly potent cells in Wharton's jelly within the umbilical cord. So this is burst tissue that has been pre-screened and basically would otherwise be discarded. And it has a powerful contingency of pluripotent cells, which we know can harvest and basically use for our regenerative purposes. We have nothing to do with embryonic research or controversial fetus. No mother or baby is ever harmed, and the procedures are fully FDA approved. Basically, these are the stem cells. They come in a frozen vial now. There's no dangerous procedures involved to harvest your own bone marrow or adipose tissue. There's no side effects, and there basically is no rejection. A stem cell is a cell, a pluripotent cell that can replicate itself not indefinitely. For about 80 cycles, it remains within your joint or your body for approximately up to half a year and directs the manufacturing of new tissue. So here's the problem: when you are a newborn, you have 1 in 1,000 cells, or stem cells, to basically form new tissue. At higher age, it goes down to 1 in 2 million. And in addition, the stem cells are toxic. They don't replicate anymore and basically do not provide the regeneration that you need. And that is frankly the reason why you are aging. And because you're aging, your stem cells also basically are not getting replicated anymore by themselves. So our umbilical cord tissue sample comes with approximately 3 million live cells. That is a lot more than what you can get from a bone marrow aspirate. And these are tested samples from third-party companies, and all that data can be provided to you. So you don't want to advance an osteoarthritis condition. You have knee pain. Basically, after stage 3.5 or 4, you're sitting in a wheelchair, and the issue ends up to be bone on bone. With the stem cell injection, you can measure the increase in cartilage, and this can be quantified with MRI techniques. So it's not just asking the patient, do you feel better? We can actually measure the new cartilage increase scientifically, and there are thousands of articles they are already published. So here's one study that basically says 30% new cartilage within 6 to 12 months. And again, this was measured with MRI techniques. And what's very interesting is that the worse the initial index of your cartilage damage was, the better the outcome. And that is because the body sends out so-called chemokines to attract the stem cells it wants to repair. However, your own stem cells are not available or they're too toxic to do the job. So now we bring in the new umbilical cord stem cells and the results are phenomenal. And in this study, all stem cell recipients avoided knee replacement. So when you get stem cells by an IV, you can see how they travel throughout the body and they basically are present in the lungs and in the pericardium to regenerate your heart. And in this case, this person had a damaged wrist, which attracted the stem cells, and also has a pancreas issue. Stem cell studies don't just involve joints, they basically show what actually happens to your overall quality of life. And in this study, participants of over the age of 60 doubled their physical performance in 6 months. And again, what is interesting is that their inflammatory markers, TNF-alpha, were reduced by up to 22% even after 180 days. Here's a very interesting result of lung scar tissue. So the reason you don't heal from advanced lung conditions is because of the scar tissue that I mentioned earlier. It's non-functional tissue and it cannot be replaced easily. That's what the stem cells do. They basically come with RNAs to turn on proteases, remove that scar tissue, and now the lung can regenerate again. And the same is also true for COVID patients who come out of the hospital after being critical with severe lung damage. Their lungs can be repaired again. The heart is the biggest issue. 1/3 of the heart can be damaged in a heart attack. That is scar tissue that is devastating, and it takes years to replace that, or it basically is permanent, and many people end up with another heart attack event. So in this study, it was shown that within 7 days, the scar tissue was renewed. So why are our stem cells so much better? Well, first of all, I've shown you that we use a very good sample, highly controlled, very potent. We have third-party analysis of all of our samples. We include post-care treatment of proper nutrition, herbal therapies. We talk about your lifestyle and proper physical therapy. And we provide Chinese medicine, acupuncture, if you choose to do so. So basically, don't wait any longer. Call us today, or you can text to this number, 206-595-3388, and we hope to see you in a consultation soon. Thank you very much.